Hooyah! This is Robin from the Back Pain Secret podcast, and today's topic is what internal organs can cause lower back pain. But before we do that, I'm going to cue up the intro song. I'll be right back. So, here's the important question. How can back pain sufferers like us, who don't want to use prescription drugs or go through surgery, heal our back pain? How do we live our daily lives in a way that allows us to go to work, take care of our families, enjoy life, and still manage our back pain? That is the question, and this podcast will give you the answer. My name is Robin Wakeham, and welcome to Back Pain Secrets. Okay guys, I'm back. So today's question is, what internal organs in your body can cause lower back pain, okay? But before we get into all of that, I had a thought this morning, It's getting cold here in Sweden, getting a bit chilly, and I'm out walking every morning, as you know, 40 minutes in the park here, and I hope you are doing the same thing, okay? But I'm getting cold, I'm feeling it, okay? So I was looking in my wardrobe, what kind of clothes could I use, to get warmer, and I'm wearing shorts, okay? I'm never cold on my legs, so I always wear shorts. I don't really want to have too much stuff up on my arms and stuff as well, okay? Because that really, it just gets me too hot, too warm. So I saw this vest that I had, okay? I had this way back, It's one of those vests that you could see in the Back in the Future movies. You remember them with Michael J. Fox? When he goes back there and yeah, it's a great movie anyway, goes back and forth in the future, the flux capacitor and all of that stuff, Anyway, so I see this vest and I get it on, and it's a bit small for me now, I gained a few pounds. It was a few years since I used it. But I say, I'm gonna put that underneath my clothes, and just, or over my clothes, but underneath my raincoat, okay? So I'm wearing that right now. And as I'm walking here, I'm thinking about it, how this actually applies to other aspects in your life, because right now I'm walking, so my stomach, my chest is warm, okay, but my arms and legs, they're still not chilly, but they're well ventilated, okay, and I feel really comfortable. And when you have patients like I have, a lot of patients, you meet a lot of people that, their core isn't really warm, okay? They're not really centered in that way, that they don't have that stability in their core. And the core, when I'm talking about the core, it's the different aspects of life, It's your relationship with your family, it's your work relationship, it's your relationship with your body, you're working out, all these different aspects, And if all those aspects are in balance, then your core is warm, and you're able to go through stuff during your day and feel quite good about yourself, okay? But if your core isn't warm and you're all over the place and you're not doing, working all those different levels, like calling your wife, to tell her that you love her, to work out every day or go for a walk, okay? Or you're ignoring the stuff at work, then one of those things in your life get out of balance, and your core doesn't become warm anymore, okay? You're all over the place and you get unbalanced. So think about that, Are you wearing a vest, and that's just like a mental picture, Are you just putting a lot of focus into one area of your life, but not delivering on other areas of your life? And is that why you're not feeling that well, okay? And is that why you feel back pain or have back pain? Is that causing you stress, okay? So think about that. Okay, so back to today's question, okay? What internal organs can cause lower back pain, okay? And the most common causes, of lower back pain are discs, ligaments, you have your facet joints, and you have muscle, all this other stuff. But you can also have some other stuff in your body that can cause problems. If you have kidney problems, okay, if you have intestines, or also the reproduction organs, okay. But I have a little story for you guys, and it's about Victoria, okay. And Victoria is, hold on, I'm gonna check out my dog here. There she is, little Eva. Sorry about that. So at least Victoria is about 30 years old. She's actually trying to have a kid. She has been in a relationship for about now 3 or 4 years with her husband, and they're trying to have a kid. But for the past 6 months, Victoria has had problems with her back pain, okay? She has problems sitting down, lying down, even walking, you know. And it's really irritating her. And she's not taking any pills, but she's going for all kinds of different treatments and trying to reduce this back pain. But it's hard for her, okay? It's hard for her. Her desire is also to reduce the back pain before they start to have a kid, okay? Or before she gets pregnant, because she knows when she's going to get pregnant and start having that extra weight around with that big belly, that's going to put more stress on her back. So she's quite stressed around feeling back pain even before she is pregnant, okay? So her desire is definitely to reduce the back pain quick, okay? And externally, she's doing all the right stuff, you know. She's going for treatments, she's exercising, she's standing up at work, she's going for walks, but still, it's this nagging back pain in her lower back, okay? So internally, she's really struggling right now with the mental stuff, you know. She's worried, she feels insecure, and she even thinks she might not be able to handle a pregnancy because her back pain is so bad, okay? Then herself and her husband went for a trip. They went to Venice, actually, and hold on, I gotta check my dog. Eva! 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 Hold on, I gotta pause this for a second. Here you go. Here she is. She's back. Sorry about that, guys. This is live, right? It's hard. So they went to Venice anyway, and they were sitting in one of those, I don't know what to call the boats, you know, when one of these guys have this big paddle and they're doing that, you know. And they were sitting there for about an hour or something like that. But when she was trying to get out of the boat, she couldn't get up, okay? She couldn't get up. So her husband actually had to carry her back to the hotel room, okay? And also, she started to get a lot of pain in her stomach on, I think it was the right or left side, I don't remember, but she had a lot of pain there. And that pain was like a nagging, really hardcore pain. She actually had to take a few painkillers, but that didn't really help her at all. And she was in another country, and she was really scared to go to the hospitals in Italy and stuff, also because they didn't really have any extra insurance for it. So the money thing would be horrible for her as well, right? To pay this extra money. So anyway, they decided to go home a few days earlier, okay, to reduce the length of the trip. So when they came back, first off, she went to the doctor, and she was telling them, her doctor, that she was trying to get pregnant, and the stress of having this back pain was causing her not to become pregnant. That's what she was thinking, at least, you know. So the doctor sent her for an MRI and also set her up to one of these fertility clinics, you know, so she can have a chat about that. Someone that really knew about that, okay? So she was doing that, and she went over there, and she had the MRI, and when the results came back, it showed that she had some problems with her reproduction organs, okay? I don't know exactly the diagnosis, but it was some cyst or something that was building up pressure on a few nerves in her lower back, okay? And this was the reason why she was in back pain, okay? So it didn't really matter how much exercise she was doing or trying to change the way of life. It was this pressure from this cyst, or something that looked like a cyst, from her reproduction organs that was causing the pain, okay? So the conflict she had now was she going to have an operation, or what was she going to do, you know? She wasn't able to exercise this away, and it was quite horrible. And also, even though the doctor had reassured her that even if you have this small operation, it's not going to mess up your chances to become pregnant in the future, okay? So she was thinking about this for about 2 or 3 months before she actually had the surgery. So they went in and they did this small procedure. They got rid of that little bump she had down there on her reproduction organs. And after about, I think, 3 or 4 months, that's actually when she visited me, because she wanted to have a few tips around what she could do with her back when she was during her pregnancy, so she would reduce the stress on the back. So we had a chat about that, and she got all the exercises, and she was telling me the story, okay, about that. Hold on, guys. I'm gonna see if Eva is here. Eva, come on. Eva, quit, up. Eva, come on, honey. Eva, come on. Come on, Evie. So anyway, she was doing that, and we went through the exercise, and she was telling me this story, and my heart just fell out for her, you know, because she was crying when she was telling me this. And right now she was pregnant, and she was very, very happy regarding that. So I'm telling you this story, guys, because sometimes it's not like your muscles, it's not your discs, it's not your ligaments. It can actually be some internal stuff that you have in your body that can cause back pain. It can be your kidneys, okay? It can be your reproduction organs or other intestines. So what I want you to do, guys, if you've been experiencing back pain for many months, okay, maybe 3 to 6 months up to a year, and you've visited a lot of different people, you know, chiropractors, osteopaths, physiotherapists, whoever, you know, and it's still not like you haven't had a diagnosis, maybe you should check with a doctor that can actually check your intestines to see if you have some problems inside, okay, that can reduce your pain. Okay, guys, I've been shouting a bit on this episode. I'm trying to still work out if I can have my dog on a leash or have her loose, okay? Right now she's kind of wild. Just check her out here. Eva, here you go, honey. Look at that doggy. Eva, look into the camera. Guys, the ones that are looking on YouTube, you can see her, okay? The ones that are just listening to this, go to YouTube and check her out. She's a little French bulldog, and she's just a great dog. Okay, guys, I think that's it for today, you know? And guys, if you like these episodes, if you enjoy them and you find them valuable, please leave a comment, okay? Please send them to a friend or family member that have problems, okay, with their back. And if you would like me to help you with your back pain, just visit backpainsecrets.com. Take care, I love you, I'll talk to you tomorrow. And guys, remember, you're just one step away from healing your back pain. Bye-bye. Want more back pain secrets? Then go ahead and get your free copy of my best-selling book, Back Pain Secrets, at backpainsecrets.com. Inside this book, you will find my top secrets to healing your back pain without prescription drugs or surgery that have helped thousands of other people just like you.